A heartbeat is such an automatic function of the body that little thought is given to its action. The heart's natural pacemaker, the sinus node, is responsible for that stimulation. The sinus node releases an impulse which causes rhythmic contraction of the heart. These contractions are normally between 60 to 100 times a minute. When there is malfunctioning of the heart's natural pacemaker, an artificial one must take over those duties. Some 20,000 Americans now have pacemakers stitched into their chest. Pacemakers deliver a gentle pulse of electricity to the heart about 65 to 75 times a minute. They contain mercury batteries, electronic circuitry, and electrodes to transmit pulses to the heart. There are temporary and permanent pacemakers. Permanent pacemakers are placed beneath the skin during a surgical procedure. Under a fluoroscope, the wire being passed through blood vessels to the heart can be monitored so that it is positioned correctly. A heart rate is set, and the stimulus is delivered to the heart. As with any electronic device, the pacemaker must be checked regularly for proper functioning. This check is simplified through a telephone system which enables the patient to phone in his heart rate from home.
This is Mr. Foster, who had a permanent pacemaker placed about 6 months ago because his heart rate had become slow and his heart wasn't functioning properly. He was having a lot of difficulty breathing, and he was accumulating fluid. So this permanent pacemaker was placed, and you can see here how the battery is situated under the skin, and it really doesn't bother him at all. And the wire then passes up and into the vein over around this point and then down to the heart. Periodically, we have the patients phone us to check their pacemaker, and this is done with this special telephone transmitting unit. Each patient with this type of pacemaker gets one of these. He will call us and then place this transmitting unit over the pacemaker. The impulses that are either coming from the pacemaker or his own heart will be transmitted over the telephone. At the other end, we will hook up a receiving unit, and we can tell whether the pacemaker is functioning properly. And then be able to read the heart rate and tell whether it's his own sinus heart rate or the paced rate. And at the present time, Mr. Foster is not requiring the pacemaker, so he's using his own rate.
Mercury batteries begin to lose power after being used 18 to 24 months. They must then be replaced. This involves returning to the hospital for minor surgery. Though still in the experimental stage, research has developed a nuclear power source to replace batteries that could theoretically last a lifetime.